Thank you everybody for coming along today. We've put together a bit of a training session for William Sazzi, thinking about how best to support him and a bit of information about some of the things that we've noticed in our work with him in the stroke service. So we'll start by thinking about the brain, a brief overview of the brain itself. Think about William's stroke, so where his stroke was and what that might mean for his cognition, so his memory and thinking, his daily function and his communication. And think about how best to support him. So we use a strengths-based approach, thinking about things that are strengths for William, what's important to him, thinking about strategies there, and also thinking about his mood as well. And you'll probably find that there's a lot of stuff in there that you're already doing really well, which is good. And then we've got some scenarios as well. So that's just to try and bring it a little bit more to life and think about how we might apply some of the stuff that we're talking about today. And it might be scenarios that you see with William every day. So it might be things that you've already got lots of skills in that you can discuss and think about together. That you already know, it might be stuff that's new, but it's just a brief overview so we know a little bit about what we're talking about before we talk about the areas that have been damaged in William's stroke itself. So it's a picture of the brain. So if you imagine, like with this face, I'm sort of sat like this and you're looking down at my brain. The brain is divided into two what we call hemispheres. So we've got the left hemisphere and the right hemisphere, and they work in a contralateral way. And that's a fancy word for meaning that the left side supports function on the right side, and the right side supports that function on the left side, pointing to the wrong side of my body, right? Mm-hmm. So they cross over. It can also be separated into cortical and subcortical areas. And these are more the outside area of the brain and the inside area of the brain. So if you think about it as sort of this, with something over it, the cortex are the outer layer. So they're typically involved in that higher level function that we have. So things like our ability to think, reasoning, logic, memory, planning, movement are all related to that external outside layer of the brain. And then we've got the subcortex or the subcortical areas, and they are in the middle. So in this picture here, you can see that's sort of zoomed into the middle of the brain. And these parts help connect different areas in the brain. So the brain works in a way where we've got certain areas that relate to certain things, but also lots of different networks that work together to help kind of produce things like memory or thinking or movement. So it's in a localized and a network-based way of functioning. And these middle areas are really, really important for those communications between areas. And they're involved in functions such as regulating movement, attention, processing, and coordinating cognition and emotion. So what we might see is that if someone has damage to an area in the brain that's in those middle subcortical areas, it has effects that we might also see in damage to other cortical areas due to the connections between places. When we think, I'm going to break down the cortex a little bit more for you. So we've got certain lobes in the brain. So this picture here shows these different areas that we refer to as lobes. So we've got the frontal lobe, the parietal lobe, the temporal lobe, and the occipital lobe. And as I was just saying, the brain works both by area and by the networks between areas. So what we might see is that there are certain functions that if there's a brain injury in a certain area, we might expect them to occur, but also we might see damage in a different area that produces a similar difficulty for someone due to the way that it's connected in a network pattern function. So if we think frontal lobe is quite commonly associated with things like executive function, which is an umbrella term for goal-directed thinking, behaviour and emotions, so planning, organisation, motivation and getting going on a task, emotional regulation, behavioural regulation. There's also some kind of movement centres there. Parietal lobe is quite sensory, temporal lobe can do memory, and occipital lobe is vision, so some broad ideas about what they cover. So thinking about William's stroke, he had a stroke in June 2024. And from the brain scans that were done at that time, they found that there was extensive damage, so quite a lot of damage. He had quite a big stroke to the left thalamus. So that's an area in that middle subcortical part of our brain. But also to regions in the frontal lobe, the parietal lobe, and the occipital lobe. So a stroke, it can be that there's a blockage in the brain, or it can be that there's a rupture in the brain, so bleed in the brain, hemorrhagic stroke, so it was a bleed in the brain from the thalamus and those areas.
Is it from maybe blunt force or?
No, so it's a blunt force might be more of a traumatic brain injury, and you can get kind of those other bleeds in the brain after that, but it was a rupture in the brain.
For William, it was he had very high blood pressure at the time, and so all that extra additional pressure on the system can sometimes just.
It was working quite a lot as well, so all that stress and pressure was causing.
Yeah, so what we can see is quite an extensive, lots of different areas that were damaged for William. So what we might expect in someone that has quite a large stroke like that is that there's quite a lot of impact on him, and that recovery might be a little bit lower than what we might expect for someone who had less damaged areas of the brain. So what might this look like? So what might we expect to see? So I'm going to speak a little bit about what we might expect to see from a stroke like this. So this does not mean that he would absolutely have all of those things, or there might be things that he experiences that are a little bit different. And then we'll talk a little bit more about William specifically and the things that we've found from our assessments. So from someone that had a stroke similar to how William's stroke, we might expect to see changes in cognition. So cognition is our term for thinking and memory and those skills. So slower thinking, taking in a little bit longer to understand any information that you're presenting to him, or kind of pull things together in his mind and process information. Some difficulty getting started, so that initiation on tasks, he might know what to do but find it difficult to start doing that thing. Difficulty solving problems, planning, organising things. Difficulty with memory and learning, so finding it really hard to learn and retain new information. And typically we might see that more short-term memory than the long-term memory. The longer-term memory for events and things in the past are typically more, they're sort of robust and stays, whereas those bit shorter-term memory of things, so what he did yesterday or last week, it's much more difficult to encode that and remember that. Reduced awareness and insight, so it might be that there are these challenges for somebody, but they find it hard to recognise that they're having those challenges. So when you speak to someone like William, he might not be able to tell you that he's struggling with some of these things. Difficulty thinking flexibly, so it might be that it's hard to move away from a topic. You might find someone perseverates quite a lot to a topic, so once something's in their mind, it's hard to change that. Yeah, and it's what we would expect, which in some ways is reassuring because it means that it's likely due to that stroke and not something else underlying happening for him. But also somebody who experiences quite a lot of cognitive difficulty like William is really challenging for him and those around him too. In terms of mood, you might see someone experiencing low mood. You might get more irritable or frustrated and find that harder to regulate when that happens. So it might happen more quickly, and when it happens, it might be harder to re-regulate back down to the baseline or a calm state. There might be increased anxiety, but also reduced confidence as well. And it's worth saying that these things, while they're up here in isolation, are very, very interlinked altogether. So low mood will impact cognition, and cognition will impact low mood as well, and they're all sort of reciprocal and related and exacerbate each other. It's a really helpful observation, and I think also highlights that everyone's different, right? So even the same stroke for somebody might increase the irritability and frustration, but for William, that doesn't seem to be something that he's experiencing.
I think that's a really nice point as well, in that like that's very much how he was before his stroke. Like, you know, so he's quite like a calm person, and even though he's got all these difficulties and has had this stroke, you know, it's not changed who he is as a person, kind of underneath it all. So,
Yeah. In terms of behaviour, we might see someone is less motivated to do things, might require a lot of prompting and structure and schedules and things like that.
His presentation can seem quite variable, can't it? I think from what we've seen as well, but every day is a we'd be quite keen to engage, and other days not.
Absolutely. So these things might be there, but again, variable depending on lots of other factors. Less able to do things for himself, so requiring quite a lot of support to do things like get up, get dressed, get washed, make a meal, and an increased dependence on other people. Yeah.
Sometimes I remember when Mickey came on trying to work with him, I have to leave the room because he's looking to me to answer all the questions. So I tend to like leave the room so that he can answer for himself.
Yeah.
Because he's always looking to me for answers.
Yeah, absolutely. Yeah, so we're seeing quite a lot of the behavioural things for William as well. Yeah. In terms of communications, changes in speaking and expression and ability to understand language as well. And in terms of physical and sensory functions, we've already mentioned fatigue for William, and fatigue is often a factor that a lot of people after a brain injury or a stroke can experience in terms of cognitive fatigue, so thinking is tiring, emotional fatigue, emotions are tiring, physical fatigue, doing things are tiring. So there's lots of different areas that can cause fatigue. Yeah. We might see changes in visual functioning, in spatial awareness, so ability to kind of locate objects in space and judge kind of where they are in distance, things like that. Balance and coordination, pain and weakness as well. In terms of stroke recovery, so I did draw this line myself, so sorry that's a little bit wobbly and not quite perfect, but this helps us to understand how somebody might recover from a stroke. And of course, there are lots of different factors and it's quite variable. But what we see at the top, this blue line, is somebody's ability before the stroke. So how they were communicating, how they were thinking, how they were behaving, how they were experiencing emotions and the world around them. All of those different factors that we were just thinking about on the last slide. And when someone has a stroke here, you see that there's quite a quick dip in that function. So the reddy, orangey, corally dot is the stroke itself. So quick dip, and then we see function gradually beginning to recover. So most of that recovery happens in the first 6 months to a year after a stroke, and that's due to heightening of certain brain mechanisms that promote that recovery. And then it will slow down quite a lot. And recovery can still continue to happen, and there's lots of research that continues to happen for quite a while after stroke, but it gets a lot slower. And what we often see is that people don't really return to that pre-stroke level of ability. And there are lots of different factors that might impact this, like how big the stroke was for somebody might mean that they're a bit lower again compared to their pre-stroke ability, or their ability to engage in things like rehabilitation. So one of the most key things that we teach is doing things over and over and over again to relearn those patterns in the brain. But if someone doesn't manage to do that or finds that really difficult to engage with, then we might expect less recovery of function.
Yeah, I've started working with William over a year now. From where he was when I first started working with him to where he is now, he's made a massive improvement. Because when I first started working with him, he was just like having a shower, having his breakfast, and straight back into the bed. And that's how he was like, he wants to do it every morning. And I was like, no, I'm not having this. I'm not having this, we're going on. So I start walking him every morning. So the first morning we walk, it just made it, not even to the end of the road, but at least I get him out of the house. And then we come back the next day, we walk up to the school, and back the next day we walk a bit further. And that's how we were doing it until he's walking all the way around the block and come back. And he Yeah, it's made a massive improvement. Because we're walking with a stick, and then I think the second we stopped walking with a stick, and then we just carry on until we don't need a stick anymore. So it has made a massive improvement.
And I think you've really nicely highlighted how things like building a good structure and routine and supporting him to engage in things that are meaningful and getting out and about and doing different things are all really important for well-being, quality of life, and noticing how that can impact
And I think the walking football done quite a lot as well. So
Yeah.
that's with you. Suggest the walking football. So now you used to like walk slowly to get the ball. Now he's running like it's like,
a competitive
I can't
streak.
believe that.
Yeah, so absolutely seeing that recovery of function.
Yeah, just
See
looking at
that.
the line.
Yeah.
Now he's looking at the line with a massive dip. So now he's like,
Yeah,
up a little bit.
yeah, it's great to see. It's so great that there is that massive improvement for William, and I think that's really lovely to hear and see. It's also really important that we know that some things are likely to persist for William. So I think in particular those cognitive challenges, they're likely to stay difficult for William. He's likely to always find those things challenging. It might be that we notice those small, slight improvements in things, and we're doing those compensatory mechanisms like making sure he's got that orientation board in his room and a routine and structure that can help quite a lot, but it's likely that they'll stay challenging for him, unfortunately. So the impact of William's stroke. So we've already spoken quite a lot about this in terms of what we've already gone through. But in terms of his cognitive function, so we know that he has changes in his thinking. And in particular, he has some challenges with orientation to date and to time. So knowing what the date is, what the time is. So if he didn't have that board in his room that we're regularly drawing his attention to, he'd find it really challenging to tell you when it was, what time it was, and those sort of things. And it might take him a bit longer to then become familiar with new surroundings and new people as well. It might take that continued exposure to those things. So for example, when he moved house, that was something that was quite challenging. Moving house is a big thing for anybody, right? So get used to new surroundings.
Yeah. There's things that you got to pack away.
Yeah, it's stressful, very stressful. And then if you do have those difficulties with orientation to date time where you are, it can take just a little bit longer to adjust to that and get used to where you are. Processing of information. So you might find that if you're speaking with William, it takes slowed down speaking a bit longer for him to understand what you're saying and formulate a response to that as well. So it might just take a little bit more time with certain things, certain activities. Memory and learning. So we know this is a big challenge for William, particularly that short-term memory. So remembering who people are, what happened yesterday, what he did, those sort of things. He can remember things from quite far back, so pre-stroke, he can remember some things that happened there, but sometimes even those memory traces can become a little bit confused and yeah. So it's hard for him to take on board new information.
Because I remember when we were talking about the job, he tends to remember the job that he was doing back home in Africa. But the job that he used to do here, he can't remember what job he used to do here.
Yeah. And that's quite often the case in what we might see with someone who experiences memory challenges is things that are quite a lot older. If you think about the amount of times that they've been sort of remembered in their life, so there's a lot of traces back to that memory, whereas things that might have happened more recently before the stroke that don't have as sort of strong an encoding in them are then harder to remember again. So things like his family will be something that he'll really remember, those events and things, but kind of what happened in the weeks before the stroke. If it was a relatively new experience for him, he might not remember that quite as well. Getting started on tasks or knowing what he wants to do in a given point, so it might be that he requires a lot of prompting.
You never know what he wants to do.
Yeah.
You never know what he wants to do. Yeah. You ask him what he wants to do today, and he was like,
finds it really difficult to think about what he wants to do and initiate that activity, even though there are lots of things that we know he enjoyed prior to his stroke, or likes doing, it's hard for him to generate that idea himself to do that. Areas of executive function, so that umbrella term for goal-directed thinking, emotion and behaviour, such as planning, organisation and decision-making, really challenging. And awareness of his cognitive difficulties as well. So he might find it difficult to tell you that he has some of these things that are challenging for him. He might. So for example, I've asked him, how's your memory? And he will say, yeah, it's okay. So he might not recognise that it's difficult for him.
Just sort of based on what we've just talked about, you started mentioning about what things you've noticed in William and sort of his cognition and how that's impacted on him participating in day-to-day activities. So what have you noticed with William based on what we've talked about with his cognition? Anything you think he's found difficult, or?
It is very difficult because if you ask William to make a cup of tea, he won't know how to. You have to guide him step by step.
Yeah.
How to make a cup of tea. Ask him. I tend to ask him questions. I don't tell him what to put in there. I tend to ask him. I said, okay, William, when you're making a cup of tea, what do you need? He said, a cup. I said, what else do you need? A tea bag. Yep, that's right so far. What else do you need? And then go on there, sugar. And then he was like, I said, what else? And he start thinking, and then milk. So where do you find the milk? In the fridge. So you go and take it out. And then I said, okay, you got everything ready. What else do you need? Water. And then you go and prepare the water.
Yeah. So those prompting questions have been sort of really helpful, aren't they? And at the right moment, it's just when you can see that he's getting a bit stuck. And coming back to the planning and thinking through the task and breaking it down. That's where I guess sort of sort of allowing him that time to try and think through the task, but then jumping in when he really does get stuck. And as you said earlier, I suppose sometimes it's difficult if he is quite variable as well. You might find that some mornings he does it sort of fairly routinely, and then other mornings
and sometimes when we're making porridge for his breakfast, he forgot that he used to use milk, so he will pour it up water.
Yeah, I've just added a couple down here. So I suppose just even thinking about starting the day. So maybe sort of helping him to initiate sort of, I think what we were doing at the beginning, initiating the day, starting the day at sort of around about the same time, supporting with meds and sort of getting into that morning routine of sort of the regular wake up, then the morning meds, then thinking about breakfast. And it might be that I suppose you've probably found all of you might need to help initiate that and sort of get that going and get him on track for that.
Yeah, so that's why we tend to start with morning routines the same. We don't really change it.
Yeah.
Because if we do change it, then it gets a bit confusing.
Yeah, so just sort of, support with that, helping starting activities, and then you said about the orientation and maybe talking through what he's got on that day, because to remember it from the day before, the previous day is going to be really tricky. So talking through sort of what he's got planned, and same with appointments as well. And then impact on daily function as well. So I guess some of those cognitive changes could have impact on, again, sort of getting started. He might wait until he's really, really hungry to get something to eat. But, if he's got a regular routine of sort of having some lunch around about the same time, I guess that would sort of support, or he might need that prompting to say, right, I need to get something to eat. And then the planning part as well, so talking through what to cook. So maybe asking him sort of what to cook, he might not come up with the answer, but sort of giving him a choice of one or two options. What do you feel like today? Do you feel like a sandwich, or do you feel like egg on toast? And you might be able to make a choice then. but yeah, so planning might be difficult, and also sort of going through the task would be tricky. He might need more time to locate things as well in the kitchen. And again, sort of going through each step, he might become quite distractible. So if there's lots of noise or other residents coming in, which I guess probably happen quite a lot, you can see he's having to really work hard to focus on the task. Then any background noise of TV, music, or people chatting, it's going to be quite hard for him to focus.
I guess if you think about the memory difficulties as well, like you're probably starting to kind of recognise the other residents, but if you're kind of in the middle of a meal and then someone you don't remember kind of walks through the door, you're going to be distracted by that, aren't you? Like any of us would be.
Well, he remembers people, but he might not be able to trying to this is your name, this is your name. I don't think he has ever called
He's never called anyone of us or name.
Even us, it doesn't say anything about name, no.
Yeah.
He never called us by name.
I think over kind of like the repetition,
Yeah.
like maybe he kind of starts to build awareness of people. When I went to church with him, I spoke to him before the service, and I spoke to him at the end of the service, and he didn't remember who I was. Like in the space of like an hour and a half.
I think when he gets to that point, start clapping and stuff. I tend to tell him I can't read sign, so we need to open your mouth and speak so I can understand what you say. And then that's when we'll speak. So I keep up to remind them we can't do sign because we don't understand sign language. So we need to speak so we can understand.
It's good. I suppose going back to be quite distractible, that could then impact safety. He's doing a hot meal, or So I guess it's just having somebody around just in case. It's a good idea. And then the fatigue as well. So might need a bit of a rest after doing something quite difficult, preparing a meal.
Yeah. So talking now about William's communication with. Super. So yeah, in this section we'll cover how William's communication has been affected by his stroke, your role in supporting William's communication, and some kind of like top tips for how you can help him in your interactions. So first, if we just think about like what communication is. So when we break it down, there's lots of kind of interacting parts that play a role in effectively communicating with each other. So if you look at the kind of diagram there, so first you hear the word, then you remember it, then you understand it, then you find the right words to respond, put that sentence together, tell your muscles what to do, and then they produce your response. So there's kind of lots of points in the chain where something could maybe go wrong. They all need to be working together for effective communication. And so for someone like William, who maybe has difficulties with remembering information, which might lead to difficulties understanding it, and which can lead to difficulties kind of finding the right word, and that kind of like planning what he wants to say being more difficult. So it's really kind of down to us to support him to adapt our communication to kind of try and unplug some of those gaps. So William has what we would call a cognitive communication disorder. So what that means is that someone's kind of thinking skills are impacting their ability to effectively communicate. So the language part of the brain, which controls kind of the language, is okay, but it's some of these other kind of networks and parts which are impacting. And those thinking skills, so things like memory, attention, planning, idea generation, they're kind of a foundation to effective communication. If the foundations are off, then it makes any of those higher level communication skills more difficult. So like having a conversation and communicating a choice, all of those are going to be more challenging without those foundation skills in place. So some kind of examples. So if you have difficulties with memory, for example, that might present as someone kind of losing the thread of the conversation when it's been going on for too long, or not remembering what you told them 5 minutes ago that you're referring back to. If you have difficulty planning, you might not be able to convey your message clearly, so it might come across a bit jumbled, or it might not have quite all the information that you need to understand it fully. If someone had difficulties with attention, then they wouldn't be able to process what you're saying, because if you're not paying attention to someone, then it's not really going in, so they won't be able to respond to your question if you've asked them one. Another kind of thing to consider with cognitive communication changes is because it's very linked to these kind of thinking skills, his communication can become easily kind of knocked off. So things can just become a little bit harder for him. And this can be caused by like internal factors or external factors. So things like fatigue, which we've mentioned already, pain, he doesn't have ongoing pain from his stroke, which is great. But like if he was to get a headache, like, we all do, or if he was to like stub his toe, things like hunger. So we mentioned that he's not always communicating when he might be hungry. So if that hunger really builds up, then that's going to have a kind of cyclical effect that like it's harder for him to then communicate that he is hungry, because when you've got that kind of really low blood sugar, you're really hungry, you're really hungry, none of us can communicate effectively when we're absolutely starving. If he's like ill, so he's like got a cold or whatever, that can knock things off. If he's anxious or in like an unsure kind of situation, that can make communication harder. And if there's kind of cognitive overload, so that's when kind of like the amount of information and input is just too much, and it's really difficult to process kind of that amount of information. And then external factors, things like there being lots of noise, even something like a room being really messy, there being lots of stuff on his table in front of him, all of that is an extra thing to kind of have to filter out or process, and just makes the communication a little bit harder. Same if like you're a bit uncomfortable, especially if you can't quite get the message together to explain why you're uncomfortable. And so maybe you've not told someone that, and then that discomfort continues and grows. So if you've got like a stomach ache, or your clothes are sitting funny. The kind of changes to his thinking skills mean that all of these things are going to have an impact on his communication, and then his communication is going to be harder to be able to address these. So it becomes this very kind of cyclical thing. So we need to really be thinking about these things for him, and just considering like, oh, that conversation went a bit harder than I was expecting it to. Like, are there any of these things which might be having a kind of role in that?
To have those factors there, because not only they impact communication, but they impact all of his other areas of functioning as well. So they have an impact on the cognitive skills, so or his ability to regulate emotions or his behaviour. So yeah, we mentioned a bit about the variability, and you also highlighted that like sometimes things are easier, sometimes things are harder. It's really hard to kind of figure out what's kind of causing that. So William's kind of communication, like I've had days where I've gone in and had a great chat with him, like, and he's been like, we've been sat there, we've been chatting, it's been lovely. And then I've had other days go in where I've gone in and it's been really challenging, and I've had to use a lot of supporting kind of strategies and things to help him get his message across. Some of his specific cognitive communication difficulties, things like being able to find the right word can be a bit more challenging, generating ideas and making choices, and being able to communicate those, expressing what he means clearly, remembering information and people, understanding lots of verbal information at once, and following kind of like multi-step instructions. So what you were saying there before about giving him literally like one instruction and step at a time,
is exactly the way to kind of help him, because if you gave him 3 or 4 steps in a row, he'd probably find that really overwhelming. So yeah. And yeah, that thing that you guys mentioned earlier about him kind of being like, oh no, you pick, that's fine. That can come from kind of generating ideas and making choices being quite difficult. There's the cognitive side of it, that actually that decision making skill is really, really hard. And then also the communication of it is also hard on top of that. So if you've got those 2 things working together, then that can just mean that someone goes, yeah, no, I don't mind. And like if he's trying to communicate something more complex, then you know, that's going to be quite difficult to plan and to communicate that. So it's our role to kind of break that down for him as well. William's communication strengths, though. So I completely agree with what you were saying earlier. The progress that William has made is amazing, especially considering that he had a really serious stroke. I met him like in hospital, like I worked with him straight away, and he couldn't say anything. So now the fact that he's able to have these conversations and you know, have nice interactions with people, it's absolutely fantastic. And so I think some of the strengths that he has are what we call like social communication skills. So he's good at kind of like turn taking. He kind of is very polite. He like understands the kind of rules of interacting with people, and that's all kind of really well preserved. And the other thing is his reading. So his reading is a real strength. So that's a way that we can really support him with things like kind of a planner, with things like writing things down. I think, you know, too much information is going to be tricky for him, but like small amounts of written information is a real strength of his in reading that. And yeah, I think engaging in conversation when he has the right support, I think, you know, that's a real strength that he has. You can have a great chat with him.
I think when Mickey suggests about writing things like day-to-day things that he does day-to-day, I tried to do it with him, but then after Mickey left, we were like, I'm not interested anymore. So I said, Nikki's gonna come back and ask you what you did yesterday, and if you can't tell me, you're gonna be in trouble. And it was like, I will tell Nikki that, yeah, I'm not interested. So I think that bit I was on doing though.
Yeah, and I think that was perhaps us trying to help him maybe to engage in what he was doing, or to be able to look back and say, well, I did this. But I think in hindsight,
but I just used that as an excuse because I want him to do it. But he just wasn't interested in doing it. So I didn't push him.
How great that he can say, no, I don't want to do that. So, it's as you know, it's more challenging for him to make those choices. Rather than him saying, really don't want to do something.
Yeah, he made that decision. And he's sticking to it. Great. So yeah, so William has some communication guidelines, which are there to kind of support your interactions with him. Hopefully they're still in his room with him and they made it through the move. But thinking, I guess, some kind of like top tips, specifically things that will help William. So making the context of the conversation really clear. So give, like, even if it feels obvious, like saying what it is. And if you need to, kind of returning through to that, like within the conversation. So like if, for example, you know, someone walks in and he does get distracted, resetting that context for him is really important. Repeating information. So obviously judge how to do this, but like kind of, yeah, like talking through things a little bit more, reiterating things a little bit more, and kind of being like, okay, so this is what we've agreed, and this is what you said, so this is what we're going to do. Because with his memory difficulties, if you've had a bit of a conversation and you've been doing all your wonderful breaking things down, which does take a bit more time, he might need you to talk him through that process again. So like, this is why we're doing this. This is what we've decided. This is what you said. Confirming his understanding. So William, because of his memory difficulties, this can lead to some understanding difficulties. So he obviously knows what things are. So like in terms of understanding the words, then that's okay. But because of those memory difficulties, because of the other cognitive difficulties he has, if you've given him a lot of information in one go, he's going to really struggle to understand that and might get quite lost. I think when that does happen with people, if they have kind of lost the thread of what you're talking about, our first instinct as kind of people is to just kind of mask it, and to just kind of answer with what we think we should be. So if you ever see him kind of saying something that maybe doesn't match what you've asked, or if you just get the sense that he's just lost the thread of the conversation a bit, going back to the context, reiterating things for him to really help him. So he didn't like the writing things down when it was like an activity. I think writing things down within a conversation is really helpful for William, because it gives kind of almost like an anchor for him to see. So instead of having to constantly reiterate the context of the conversation, if you've written down like, activity today, then he's got that there. And so he can see that, he can look at it, and throughout the conversation, it's kind of reinforcing what it is you're talking about. And it can kind of just provide a bit of extra scaffolding for the understanding of the conversation. We mentioned giving choices already, so like, yeah, which it sounds like you guys do a lot, but like, yeah, just giving those choices to him, and based on what you know of him and his preferences, it's going to be a lot easier for him to choose from some options that you give him than for him to just generate something spontaneously. And so even if he's saying like, oh no, I don't want to do anything today, like I just want to stay in bed, it's fine. If you ask him, oh no, what should we do today? And then he'll be like, oh no, I don't know. And if you just keep asking him, what should we do? Which is a really big, open question, that's going to be quite overwhelming for him, and he's not really going to be able to make a choice. But if you give him like, well, we could go for a walk, or we could go down to the shops, or we could call your sister, and you can write them down on the board as well, so it's not too much. And then he might be able to make a choice from that a bit easier. Just giving him extra processing time. We've spoken a bit about how it's a bit more difficult and needs a bit more time to process information. We've spoken about not saying too much in one go, so breaking things down, and then using picture resources and objects if needed. So from having met William, I don't think he needs these every single day, but maybe on those days where he's finding things a bit more difficult, using those picture resources or using objects to help him make choices could be helpful. Some of the physical things which might help him. So we've spoken about the daily planner, using a pen and paper, and that's very much for you to use rather than him to write things down. Like the picture resources that he has. So we made him a food and drinks I like resource, which hopefully he's got with him. And then having things like written visual instructions, or things like having pictures on the cabinets. I don't know if you have that.
We did have a soundware, we did have, but I think I've left them down.
Yeah.
I've left them there, so we need to make some new ones.
Yeah.
We need to make some new ones.
Although if you can see the stuff through the thing, then it's a bit less difficult, but I guess it's something that maybe he might notice a bit easier. Yeah. Great. Okay, that was a whiz through. Shall we?
Do we have a break?
Okay.
I'm coming to the end of school and it's just like astounding.
I thought you meant like the end of school, like finishing school forever. I was like, no, surely not.
No, I've got one in year 6 and one in year 4 and primary school is just nuts at this time of year. There's plays, science testing today. There's it's just like humming on my brain. It's like just too much going on. It's been quite cool at the end. Yeah. So yeah, it's yeah. It's a holiday. It's more stuff.
Just the planning of what to do kids every day.
Yeah, there's that. But yeah, it's a bit more relaxed. It's just worried at the moment I'll forget something or, you know, forget to do a sweets and performance and the kids and everything.
And you hear of them being stood there.
Yeah, I know.
Does that mean your one is going up to secondary school?
Yeah, I've got my eldest is there now, she's going to year 9, but he'll be starting year September, so he'll be fine. He's just he's a bit of a social butterfly, typical boy, and different mates and football friends, and so he'll be fine. He'll be more than a drive. Just
A lot of his friends stay in the same school.
yeah,
That's nice.
it's just quite nice. Yeah. And he's like, yeah, he loves football, so he's got loads of friends from different schools as well. Because they'll also go to us. So.
I was really excited to go to secondary school when I went.
So exciting.
Yeah.
It's huge, isn't it?
My niece is going to secondary school this year, but she's really young for her year. Birthday is 26th of August, so she's like as young as she can choose.
Yeah.
And she's dyslexic, and basically the first like 3/4 of her primary school life was COVID, so like didn't get like anything.
Yeah.
She's so young and like.
The age difference of that, the gap at that age is massive. So my nieces my daughter and my niece are 2 months apart, and even then when they started school, you can see the difference is 2 months.
Yeah.
But yeah, my youngest is August as well, and yeah, she's constantly trying to keep up.
Yeah.
Yeah. It's kind of like levels out after a while. Such a big gap. They find their people, don't they? In secondary school, just one knows it's similar and just right.
Reassurance that like the majority of plans are fine on paper.
Yeah.
Like it's that one, so.
I know, yeah, I really think that is times secondary school.
So your kids have phone?
Yeah, so my eldest had a phone when she was in year 6, so she's, my niece had a phone in year 6, so she had a phone. So we set that level that we then had to wait. So Harry has just got a phone in year 6. But we held off to do good for him because, yeah, I don't know. And then my eldest just seemed to be a little bit more self-aware. Whereas, yeah, I could see him ploughing into WhatsApp groups and all sorts of stuff. And it's another thing to police as well, which is really hard. So yeah, so he's got it now, but we're having to kind of watch his screen time.
My eldest niece who's going into so much school in Scotland for years, makes sense to be done. She's been at secondary school for a year and a bit already. So she got a phone when she went there, but she doesn't have like anything on it. Like literally it's just
maiden vocals because she didn't want one initially, and my sister-in-law was like struggling to find one because it's so big, so she needed one to like phone and say that she wasn't going to get. And the tracking one is quite handy sometimes.
And I was like,
Sorry. Carry on. Okay, so supporting William, so looking at a strengths-based approach. So we just added in a slide of what's important to William, so feel free to add anything that I may have missed out on. And you may know a lot of these already. So avid churchgoer, really big on faith and his Christianity, and also before his stroke, because I think he was a pastor in his old church, and sings as part of the choir there as well, and goes there with his family. And yeah, family being the key main sort of thing on that slide as well. Yeah, so he's really close, isn't he, to his sister Olivia, and has two teenage sons. Recently split from his wife, but and then he's got some family back in Ghana as well. Olivia actually describes him as a mummy's boy. He said before the stroke, he was very close.
His mom does phone regularly. His dad does as well, but his mom mostly.
So that's really important. And work as well. I think he had quite a strong work ethic as well before the stroke, and I think we've mentioned it a few times. And he says he sort of wants to get back into doing some sort of thing.
They keep telling him that if he wants to go back out, you need to put the work in. And I don't think he will go all day if you just keep lying around. The boss is not going to pay you to lie around.
So what did he do before? He was a prison escort for Magistrates Court. He had a background of accountancy as well. So you can see sort of how he wants to get back into doing something. I mean, we have reached out to Disability Employment Advisor to see what there is out there in terms of voluntary work that might be able to maybe support William.
That would be very difficult. Since he doesn't really want to go out, and he just want to go and lie down and sleep. I thought about it as well. I thought about volunteer work, but you just don't have the energy to go and do the work. But there's a Salvation Army charity shop. I was thinking about out there and kind of signing up.
It's tricky, isn't it? And it's finding the right time and the right support. And it's where maybe the advisors may be able to come in to suggest what there is out there, and you may be able to engage in, but when the time's right and with the right support. And music as well, sort of a big part of his life. So he was a guitar player, keyboard player, sings, as I said, in the church. Football as well. I don't think he supports the team, but big on football.
He doesn't support the team as such, but he just likes to play. But he doesn't support the team.
Okay. So I suppose that's where nice walking football's coming, because it's sort of captured then his interest in getting out and getting doing something. So
he finally met a friend at walking football. When he first got there, he would just sit by himself and he wouldn't engage with the others. So I have to try and tell him to be more engage in conversation with them. But now I think he met this gentleman. I think he's from. Where is he from? He told me, but I can't remember which part of Africa he's from. But every week he went there and engaged in conversation with him, and William was like, "Oh yeah, this is my friend," and we talked together. And that's good progress.
Okay. So looking at strategies, so what can we do to help William? Okay, so I think we've touched on a few of these points already, but definitely with supporting a regular routine, and you said how that's maybe helped as well. So from the start of the day, working all the way through, we can set some sort of support, some sort of regular routine for William, so getting up at the same time in the morning, and medication, breakfast, setting that routine. And the helping with orientation in the morning, setting the scene for the day, so what's happening that morning, getting started, and then providing the choices, we said. So reducing noise and distraction when doing an activity, so try and keeping it sort of calm and quiet, allowing William to focus, and giving time as well for William to think things through. We said items to be kept in the same place or labelled up to help with memory. Prompting when needed. So allowing that time, but then breaking down steps and prompting William when needed. And encourage the rest if William's feeling a bit too tired after sort of busy activity. You got any questions, sorry, about that last slide? Or any strategies that you may have used that would be helpful?
It's been less explanatory enough, so there's still part of day-to-day planning we've been implementing from day one, so.
And that's a bit of structure from the outset. Okay. So I think this was sort of just an idea for like a daily planner. So I think we put this together sort of in fairly early stages of when we were supporting William, what maybe a day-to-day could look like, and how to prompt and support William. Won't go into all of this now, but it's on the slides. But it's like we've talked about, breaking it up, when to encourage, having in rest periods.
Because the shower now, remember when he was at Sandwell and the whole the shower for him?
Yes, yeah.
But now, because there's it's a shower instead of a bath, so he just goes in and does
now, and that's sort of just become part of that routine. Then in the morning, he then just goes into a sack. Does he collect his clothes, or do you?
Yeah, he does.
Yeah, okay.
He does
So that's good. Yeah.
But then sometimes he will take out his church clothes. So we have to go in and explain to him that this is your church clothes. This is what you wear when you're in the house.
Yeah.
So
Yeah. I know we've tried to incorporate some domestic activities, like we've been doing some ironing. I think we mentioned about sort of changing the beds, and I suppose to.
He does need his bed every morning.
Brilliant.
As soon as he got up, he just made the bed.
It's just become more automatic now, as perhaps in the beginning wasn't so much. And then I think in the evening, so we mentioned about the an outdoor activity as well, like going to the cafe or going for an outside walk, which he's been doing. And then in the evening as well, those exercise groups on the Different Strokes website, which I think he was doing that as well. So Just things to promote his engagement and yeah. So that's all there anyway, just as an example.
Yeah, it is, isn't it? So I think it's a really nice segue in from that things like routine and all those meaningful activities that you're engaging William with really do support his mood, well-being, quality of life as well. And routine can be such a helpful thing, particularly if you struggle with orientation and memory. It can be really frightening and really scary. So having that predictable routine and regular people supporting you can really support that in a sort of indirect way of supporting mood. We've briefly touched on William's mood right at the beginning when we were looking at factors that can be influenced by his type of stroke, and we noted that there's not really any changes in sort of frustration and irritability, but can sometimes experience some low mood. Does that feel like it fits with the picture that you're seeing? Yeah, okay. So he can appear lower mood at times, but due to the really significant cognitive difficulties that he has, it's likely to be triggered by what's happening in that moment. So he's not likely to be able to retain something that's happened even an hour ago or moment to moment. It will be what's happening, so for example, a conversation around his children, rather than a persistent low mood that continues from time A to time B. So it's very sort of reactive to what's happening around him. And it's likely that after he has these periods of low mood or periods of distress, he's then unable to remember why that was or even that happened. So he might have a bit of low mood in the morning because of a prompt in that environment, but then by the afternoon might not be able to remember that he was feeling low in the morning. And you might ask him, how are you feeling? And he might say, I'm positive all of the time, I generally feel happy all of the time. So it's most helpful for us to support him in that moment, rather than try and kind of connect all of those times together and offer something across. It's responding to what we're seeing in that moment and supporting him to feel safe, comfortable, and express his needs at that point in time. Does that make sense? Mm-hmm. Yeah. So things that you can do when he might experience that low mood: offer reassurance and validation to him. So it might be things like, William, that sounds really difficult, or I'm really sorry to hear that that's happening for you. Allow him the space to feel upset. So sometimes I know it's really challenging when we see someone who's upset and we want to make it better, but just giving him a little bit of space and time to feel those emotions when he's feeling them, so he doesn't feel like he has to be happy all of the time. It's a normal human thing to get upset from time to time. Remind him that he and his family are safe. And maybe gently direct his attention towards something meaningful or something that he enjoys. So, for example, his Christian faith or something like that. And it might be that you do these things in sort of that order.
Oh, yeah, because when he decided to go into his room with us for his telly on the church service.
Yeah.
And we sat there and we were watching.
Yeah, exactly. Yeah. So it might be that you'd say, he tells you that he feels upset, you offer reassurance and validation. Oh, that's really difficult, William. I'm sorry to hear that. Sorry, this is what you're experiencing. You're safe. Give him a bit of time and then say, what's something? Or let's put your church service on the TV, or would you like to do this or this, offering these choices. Redirecting him towards something that is meaningful to him. And as a wider, which it sounds like you're all doing really, really well, wider supporting of wellbeing, continue to offer opportunities to engage in meaningful activities and keep them regularly scheduled in his day to day as well. He'll likely find it easier to talk about those older memories, which is something that I know you've already highlighted. So supporting him to engage in conversations about those things to help him really connect to who he is, to who William is, what's important to him. And that's what were his hobbies, his family history, his achievements, his job in accountancy, all of those things, that he's still got a sense of identity as William and knowledge of himself as a person. Okay. Is there anything else that you've noticed helps William in the moment if he might be feeling a bit low?
Yeah, I think that's all. That's everything. Because looking at the last one, William will likely find it easier to talk about older memories. Please support William by engaging in conversation about his hobbies, family history, achievements. I think those are what we've been trying to do, trying to connect him back.
Right.
And I got to know that he still remembers, and he said the job, and even now, I think he's beginning. I remember you said maybe the ones he did here, he's beginning to remember bit by bit. Because I remember the last time due to the fact that I just saw his old ID of where he worked. Oh, you worked here? Okay, so what were you doing? This used to be a very tough job. How do you handle it?
Yeah.
So it starts saying, I think it's as a prison officer here or something. So he remembers, it's like, oh, okay, this was what I was doing. It was what I was doing. So, and like I said, it's still when you are armed with the information of what he did in his part, you'll be able to engage him well with his conversation, with the conversation. So he starts, okay, yeah, this is what I did that time. Oh, what are you doing back in Africa? Ah, yeah, there was a time I worked at the post office. So what do you do at the post office? Yeah, letters. We were, what was it? Delivery. Yeah, he said it. I said, okay. So after you left post office, what did you do? I can't remember, but did you ever work in the bank? Yeah, I did. Well, I was mapping out loans. I was recovering loans. You know, sometimes you can't just give out loans. You must know the credit history of the person. If it's to start, to start. So definitely, when you have those kind of information, you'll be able to. But one thing about him too is that, like he said, he's still part of. If he doesn't want to have that conversation, he just
stopped and changed it.
Absolutely. Led by him is really important, isn't it? That if he says, don't want to talk about this, then.
So everything is about mood. So. Then sometimes TV will be happy to watch sports, sometimes no. Music. Sometimes he might not. He's not ready to. So.
Sometimes you just want peace and quiet.
Yeah. So basically, most of the information I've been getting from the sister. You know, family members that knew him before the trauma. So.
Yeah.
So okay, yeah, I used to do this. I don't mind him. He doesn't want to do these are things he loved doing before now. So those things, but like I said, some old things that he loved doing, doesn't want to do them no more.
Yeah.
That he loved, they said, oh, this is what he used to do. He doesn't want to do them no more. So, well, like I said, with time, it's going to get better. It might take time. Anyway.
You gave a really nice example then of helping to connect William to who William is. Because quite often when someone experiences such a big thing like a big stroke, then become the stroke or become their difficulties. But actually William is a person and William is still William. So connecting him to who he is and what matters to him and having those conversations is so important. It sounds like you're doing a really good job at doing that in a really structured way that is thinking back to all of those cognitive challenges where he'll find it hard to generate those answers himself. Any more thoughts or questions about mood?
I think one thing I noticed with him as well is if they speak about his children, he gets really low.
Yeah.
Because he don't get to see them very often. So he gets really low. So he tried to stay away from that topic. We talk more about his sister and mom and dad. That's where family is more used to listening very often.
Yeah. And it's really tricky because he finds it hard to retain the information about his children and know exactly what's going on in that scenario. So it's being led by him because it's also important for him to have space to talk about his children, but whether he feels comfortable with doing that or not
Yeah,
in any given moment.
because I think that probably triggers some memories that we don't want to
Yeah.
remember.
Or worries about where they are, what's going on, why he's not seeing them. Yeah. Yeah. Absolutely. Okay. We've put together some scenarios. So the idea is we've got 3 different scenarios based on 3 different things that might happen for William, and we can all think together about what you might do in those scenarios based on the rest of our presentation. So Nikki, over to you. Do you want me to? I can read it out. Save you. Yeah. Okay. So, how might you support William and include him in doing something domestic around the house? So, for example, making a meal.
At the meal, he's not interested in doing meal, but breakfast,
Mm-hmm.
he will do breakfast. But for mealtime, he's not interested in doing that. And so, he just don't want to, he's just not interested. But with breakfast, he will.
Yeah. So maybe it's thinking. So rather than making a meal that he doesn't want to do, maybe it's how might you support him
Breakfast is more
to do breakfast.
to do
Yeah.
rather than the meal. Sometimes I said, William, come on, let's go pack for your meal, your evening meal. Not interested.
So yes, if made a meal, you can see how that could be quite
Well,
overwhelming.
it's quite overwhelming.
Both to start and whereas breakfast, I guess that's something you still have
That's
porridge
quite
and toast,
simple.
something that you can easily break down.
Yeah.
I don't know if it tends to be quiet, does it in the morning as well?
It tends to be quite
Very quiet.
quite in the morning.
I'm just wondering as well if there was kind of maybe a bit more of like a lead up to making the meal, like with him with talking about the meal, with like him choosing what it is that he wants to eat, and then maybe like agreeing to do it together. That kind of like scaffolding might get him there, or you might just be like, no, I just want you to do it. But
doesn't want to.
yeah,
He doesn't want to. Like it's a sore topic, but he doesn't want to do that. Yeah.
about at lunchtime.
Lunchtime.
He'll be like, what would you like to eat for lunch? He'll tell you, whatever you give me, I'm okay. So that's his response. What? That's what he says.
That's what they say.
And then he'll tell you, that's what they're saying, and you ask him, no.
That's what
He
he said.
says, never mind them, and he starts laughing.
That's what he said.
Yeah, that's what they say.
That's quite a good example of like one of those very open questions.
Yeah.
What do you want to have for lunch? So for like someone like William, that's going to be really hard for him to answer. If you had that situation where you'd asked him, what do you want for lunch? And he said, whatever you're making is fine. How do you think you can kind of break it down?
Just
Maybe
give him
you should
choice.
just give him the choices. See, we have chicken, we have beef, we have rice, whatever. You give him the options and see maybe if he can choose.
Yeah.
But still, in the same scenario, you give him options and you still say the same thing.
Yeah, he will tell you the same thing. You've tried.
Yes. Whatever is
Whatever you serve me,
It'll be fine.
will be fine. And William will eat anything you cook for him,
Yeah.
and he will never say nothing. He can complain.
It's tricky, isn't it? It's really tricky.
Yeah.
I guess every day could be different. I mean, where do you have those conversations? Do you have them in his room? Do you have them in the kitchen?
Or even in the
Kitchens
kitchen.
in his
Or even in the kitchen. Or when you go out for a walk. My first study actually was the one leading us This way, this way. That's nice, William. We are following you. Mr. Chairman, every time you are out, it was very interesting. You see that he's happy.
There are things that he's willing to fully engage and cooperate with when it comes to choosing meals.
So it's sometimes I feel it's up to us to make sure that whatever we feed him is nutrition, is a healthy choice. Because it'd be like whatever you give me, I'm good.
Yeah.
Yes, so it's up to us to make sure he eats well.
Yeah, I think there's definitely that, which is great. Like, because in terms of like preventing a stroke and that kind of stuff, eating nutritious food is very important. Our assistant made a resource of pictures and things of foods that William likes to eat, and so I guess it's what you were saying there about kind of it being more on you guys to decide to make healthy choices for him. It's also on like when you guys get a bit more, I guess, to make sure he's eating the food that he likes.
But then like
We've got Dora here with cookies.
they are more or
country
less they are more or less from the same.
Well, it's the same West Africa.
Yeah,
I would
West
say,
Africa.
or at least.
So
they eat almost the
they all
same.
leave the meal cooking to Dora.
I think what really brought that was I think there was the food choices that was printed.
Yeah, that's what she said.
Yeah, I think that was what brought me. Okay, I think I can do it. Definitely, we don't really have the same foods, but I still know some are similar that I know I can still
Do something.
do something. So
I tried because his sister said to me that we love Jamaican food. So I tend to try and cook some of the Jamaican food for him, and he loved it. Like rice and peas, I will cook rice and peas for him, and he loved that. So I tried to do jollof rice. I tried to do the jollof rice for him, and he does eat it. He said it's nice.
Yeah.
He said it's nice. So yeah.
Sounds like you're doing a brilliant job. Like, thinking about that.
it's just
And actually, he put on 2 stone.
Oh, really?
Put on 2 stone when I took him to the doctor, and the doctor was like, "Oh yeah, is this the lady cooking for you?" And he said, "Yeah." He said she must be doing a good job because she put on 2 stone already.
So in addition, the only thing is okay, fine. He enjoys more of his local foods, but sometimes it's maybe due to funding, it's difficult because these foods are not grown here. It's definitely be imported from Africa, and so they're expensive. So there's kind of funding impediment.
Yes, I'm trying to improvise and
So
Must something like plan around his budget.
then around this point, and also activities also. It's cost more to really engage him for 5 days a week.
He would love to take him out
every day. It's,
Budget
but because of the
come along
budget,
too.
it's the budget constraints. It's there, so.
And I guess with the meal, it's just, I suppose it's just encouraging his participation, even if he's just in the kitchen and he's getting utensils out the drawer for you, or, if he's getting something out the cupboard. And so, I suppose when we're asking him to make something for lunch, we're not asking him, can you make it? We might be saying, oh, could you just help me get that down from the cupboard? Or could you just give me a quick hand with this? So I suppose he doesn't feel that you're asking him to then prepare something that's quite overwhelming, which I'm sure you do anyway, but it's, I guess, any ways like that we could engage him, bring him into the kitchen, getting him involved, even if he doesn't feel like he wants to make it, he's still there present and what's going on. So, yeah.
So basically, So basically, more funding would
Sometimes
get
does,
the recovery faster. Maybe it's when we're having more activities, making it better.
Yeah.
Okay, so our next scenario. William has run out of food and needs to go to the shops to buy food for the week. You need to discuss what he wants to eat and drink and what you should buy at the supermarket. How might you support him with this?
We could do a shopping list for them.
Mhm.
Tons of do a shopping list for them. But then, when you get to the supermarket and then you'll say, is there anything that you would like in the shop? Anything that you would try? Like, no. You carry on. So
I guess if you're thinking about those like external factors, once you get to the supermarket, there's quite a lot going on. Like he's maybe a bit fatigued from walking there. Like there's the visual distraction of everything around, there's the auditory distraction of all the sounds. So it would be quite difficult for him to then kind of communicate what he wants. So it sounds like you're doing completely the right thing, sitting down with him, like, you know, in his room or in a quiet environment first to have a bit of a think about what he might need. In terms of how, like, when you're having that chat with him about what should be on his shopping list, like, how do you kind of adjust your communication with him compared to how you might chat to, like, I don't know, partner or something?
We'll just sit down with him quietly and just ask, you know, like in the cupboard as well. We go to the cupboard and say, you know, check to see what he runs out of or what you're running low on, and should we get some more of that, or get some more of this. And then I said, well, they'll check the fridge for the milk. How much milk do you have? Should we get some more? And he was like, yes, and I said no.
Nice. That's a great example of kind of like using the context of like the kitchen, using the actual like things themselves to support him. I did write down.
Just got one more, Katie.
Oh, sorry.
This is the last one. You walk into the room and find William sitting in his chair crying. When you ask what's wrong, he tells you that he's worried about his children. He says he doesn't know where they are and if they're okay. How might you support him?
We try to reassure him that the children is fine. We try to make contact with his children, make sure that we've spoken to them. And make sure to give that reassurance that they're fine.
Yes, that's great, yeah. Reassuring them that they're safe, they're okay, offering in contact with them. Is there anything else that you might do to support him when he feels maybe a bit low?
Yeah, we're working in collaboration with the families, with the family, most of the time with the sister because what I realized in the last couple of weeks, I think we tend to forget the memorable days like birthdays of the kids, and so there was a time on the Sunday. I think he spoke with the kid, and he said, "Oh, that's my birthday." Oh, we forgot. No, I didn't know that kind of thing. So, we've been working with the family to get those memorable days. You can always call them up. Okay, so's birthday is today. We like to call this person. Like, okay, this kind of, so we've been trying to get those dates, so we can, that sense of belonging, that sense of, okay, there's a lot of people we can swap, so.
Yeah, and that connection.
So yeah, that connection kind of, so.
Yeah, that's really great, that's great.
Yeah.
helping him to connect with family and remember those important, meaningful days and events that and do those things that he would have done, like call and speak to them before.
And I remember when was Father's Day? Yeah, back in June. So he let me. He was aware of the fact tomorrow is Father's Day. Like this was on a Sunday, and we had to, like, okay, when we're trying to work with this church outfit. Definitely loved traditional. Sometimes they tell you, I want to have a traditional attire to church. You say, oh, this coincides with the Father's Day, so you must. That you can, not even you must, I would love this. I said, there's going to be a lot of celebration back in church and everything. So he was aware before he left, he came back, he had for Father's Day chocolates, you know. So he is happy with such, so all those kind of memorable events that, you know, it lifts his spirit and soul. Let me put it like that.
It's a really important thing.
They're uplifting to him. So.
Yeah, that's great.
And I think he forgot to eat the chocolates until I went in.
Yeah.
Father's Day is fast. What are you thinking about this? I said, I'm waiting for you.
No.
Yeah, we share. I said, okay, with him. That's so
Yeah, absolutely. Some great things, offering him kind of reassurance, helping him to connect with family, things that are meaningful to him, and letting him know that his children are safe and he's safe, giving him space to feel that upset if he wants to, and lots of those examples that we spoke about just a minute ago, of redirecting him to some meaningful activities and things like that. Right.